Hey everybody, we are now going to go over chapter 10 in your Pharmacology Clear and Simple book. We are going to be talking about parenteral medications. That means that is everything else other than enteral, okay? Here are your learning outcomes. Here are your key terms, which you definitely need to be familiar with. So parenteral medications are all medications that are not introduced into the gastrointestinal system. So they can be topical, like a cream on your skin. They can be ophthalmic, which is in the eye. They can be otic, which is in the ear. They can be vaginal, which speaks for itself. Nasal, so inside the nose. Inhaled, or injected into a muscle or skin or so forth. So you definitely need to know the differences between all of these. So topical medications, these are applied directly to and absorbed through the skin. It may be for a local or a systemic effect. There are semi-solid preparations. That is, these are your ointments, petroleum-based to keep medication in contact with the skin. This can be a cream, which is usually water-based and absorbed into the skin and then disappear. Then there can be gels, and these are semi-solid suspensions. So basically, when we're talking about a local or systemic effect, a local effect is basically specific to that particular area. Systemic means it affects the entire body. So, for instance, a local effect would be hydrocortisone cream for rash or itchy areas on specific parts of the skin. Medications that have a systemic effect that affects the entire body is a medication called nitroglycerin. This is actually used for the prevention of angina, which is chest pain. Plasters, these adhere to the skin with paper, linen, moleskin. Liniment or salve, this is semi-solid preparations causing irritation to the skin to increase blood flow. Lotions are water-based semi-solid preparation, and those are just different topical medications that go on your skin. There's also solid preparations such as powder. Powders usually reduce the moisture, such as nystatin powder underneath the breasts or skin folds. Also a transdermal patch, which delivers medication over time. There's actually a medication called scopolamine that goes, it's a transdermal patch that goes behind the ear, and it is for nausea. So advantages of using a transdermal patch include ease of application and removal, effectiveness over time, and reliable results based on even drug distribution in the body. These topical medications are also used for pain relief, nicotine addiction and treatment, angina prevention, and hormonal treatment. So again, the advantages of transdermal patches is the ease of application and removal, the effectiveness over time, and the drug is distributed evenly. Disadvantages of these, sometimes it's hard to keep the patch in place, especially if the patient is rolling around, moving around, or in therapy, walking around. Some patients' skin is not ideal because of excessive dryness or excessive oiliness, which can cause the patch to fall off. Failure to wipe away leftover medication at the site when changing patches can lead to medication overdose. Also, if patches are not disposed of properly, Pets finding the patches in the garbage may be exposed to the medication and become very sick and even die. Also, children as well. Most patches come from the manufacturer ready for administration. When you are placing these, you need to wear gloves so that the medication from the patch does not enter your body. Remove the sticky backing on the patch and apply the patch to an appropriate location on the body. Be sure the area is free of tattoos, scarring, and redness because these features may alter the absorption of the medication. Also, teach the patient to rotate sites to prevent skin irritation, and you need to place it on skin with minimal hair because it can make it come off easily. So, what would be the effect of cutting a transdermal patch, and is it advisable? It is not advisable. The patches are used to basically emit medication over a certain amount of time. And if you cut it, you're basically getting it all together. So you really do not need to cut the patch. So, ophthalmic medications. These are medications placed directly into the eye. These medications are used to treat infection, glaucoma, and also for facilitation of eye exam and treatment. So drops actually lubricate the eye and they treat conditions through absorption. So the mucosa within the eye basically absorbs the drops. Now, ointments are thickened drug solutions that are applied to the inside lower eyelids. Ocular inserts are small transparent membranes containing medication. And you always have you need to see the procedure box on 10.2 just to show you exactly how to administer these medications. So definitely have the patient look upward when administering meds to the eye, because if they're looking down, the medication is not going to go directly into their eye. Always wear gloves when you are giving ophthalmic medication. Avoid touching the dropper to the eye to avoid spread of infection. Of course, have patient look upward. And you always want to administer drops before the ointment. Okay? Drops have to be administered first because the ointment will form a barrier over the eye and it can keep the drops from being absorbed. Now, otic medications are medications placed directly into the ear canal. These are used for infections of inner and outer ear and also for impaction of earwax, also known as cerumen. Always keep these otic medications at room temperature to reduce comfort. Pull the pinna back, and the pinna is basically the outer ear. So, pretty cool little thing. You pull the pinna back to straighten the ear canal. So in an adult, you pull it up and back. For a child, you pull it down and back. Also, the patient must keep the affected ear upright after administration to allow for medication absorption. Sorry about that. Vaginal medications. These are used for local effects. These are foams, gels, and jellies, creams, lotions. Most commonly, they're self-administered. It's best to have the patient lay on their left side to ease the administration of these medications. You possibly may have to actually give these in clinical. I've given a ton, so. Nasal medications. These are used to treat seasonal allergies, asthma, congestion due to colds, other sinus conditions. They come in spray or inhaler or installation. So before you give this medication, make sure that you have the patient blow their nose first and then administer the medication. Have the patient tilt their head back to facilitate absorption of the medication, and then rinse the dropper, not spray bottles, when done. Inhaled medications are medications and oxygen administered directly to the lungs. These are used to treat asthma, cystic fibrosis, sleep apnea. Now, sleep apnea is basically treated by this. What it means is they stop breathing while they're asleep. A CPAP, I'm sorry, a CPAP is a machine that is, it's called a continuous positive airway pressure machine. You'll hear it called all kinds of different things. It's really kind of funny sometimes, but it's called a CPAP. This machine forces room air or oxygen into the lungs when the patient forgets to breathe or while they're asleep and they stop breathing. MDIs, or meter dose inhalers, these are used to deliver specific doses of medication through a handheld inhalation device. This is usually used for different respiratory conditions. And then also there are spacers that are used with the MDI to allow the patient some control over when the medication is inhaled. A spacer is an extension tunnel that attaches to an inhaler and allows the medication to be held and administered whenever the patient can inhale, rather than escaping into the air if the patient exhales instead of inhaling. Also, nebulizers. These are medications added to a machine that aerosolizes medication into fine mist for inhalation into the lungs. Patients with cystic fibrosis use this treatment a lot to deliver medication to break up the abnormally thick secretions in their lungs and allow them to be exhaled. So what should you teach the patient about cleaning and replacing their mask and tubing with a CPAP? Honest to goodness, think about how dirty that they can get. So make sure that you are educating your patient to clean that mask. So now we're in injectable medications. So intradermal, or ID, this is injected just below the epidermis. You will have these with TB and allergy testing, and usually the site of injection is usually the inner forearm or the upper back. For ID injections, you're going to give the angle is going to be 10 to 15 degrees, which that's the insertion angle. Do not aspirate for blood. And if it is performed correctly, a wheal will form. A wheal is basically a little puffed up place, as you can see on that picture. Also, a little bit of blood is normal after these injections. That's okay, because, you just went through some skin and it's okay. If the wheal does not form or the medication leaks, you will have to repeat the procedure. So if you see the medication come back out and that little wheal did not form, you're going to have to repeat it. Can you think of a way to make it more pleasant for a child to receive an intradermal injection? Just a good little, you can come up with all kinds of different things. You can put stickers on their arms or draw bunny faces or different things that will make it better for a child. So an intramuscular injection, this is medication that is injected directly into the muscle. It has a very quick absorption into the bloodstream. The route used mainly for antibiotics, pain medications, and immunizations. The site is chosen based on the viscosity or the thickness and amount of the liquid that is being injected. So the needle is usually 1 to 2 inches in length and 20 to 23 gauge. You will give it at a 90-degree insertion angle. You're going to use a dart-like motion to insert the needle completely to the hub. Gently and slowly inject all medication. So the deltoid is a site that we give a lot of medications in. It's preferable a 1/2-inch needle, but it's limited to a 1-inch needle. I would always prefer a 1/2-inch needle as compared to a 1-inch for the deltoid, just because it's very close to the skin. But you have to understand, if there's more than 1 milliliter of fluid, then you can never give it in the deltoid. You have to put it in a different site. The deltoid can only handle a maximum of 1 milliliter. The ventrogluteal, this is considered safe for all patients older than 2 years old. To locate this site, you're going to place the heel of the hand over the greater trochanter of the patient's hip with your thumb pointing towards the patient's umbilicus. Your index finger should be on the patient's anterior iliac spine. Spread your middle finger back as far as possible. The injection is then given in the center of the triangle formed by your index and middle fingers. And these have to be at least 1 inch. The vastus lateralis is the site of choice for infants and small children. And you can see where that is right there in the thigh. Also, some medications have to be given by the Z-track method. This is a method of intramuscular injections used when either the medication is irritating to the skin, if the medication may stain the skin. There's a lot of medications that will do that, such as vitamin B12 and also iron. And these are usually good in the dorsogluteal muscle. And before you insert the needle, you pull the skin laterally 1 inch away from the injection site. You're going to wait 10 seconds before removing the needle to allow the medication to be absorbed deeply. And that's the Z-track method. Subcutaneous injections. These are medications placed in fat layers under the skin. Medications are absorbed more slowly than an intramuscular injection. These are used to administer heparin and insulin. Subcutaneous injections. The sites are usually the fleshy part of the upper arm, abdomen, and thigh. And it's always important to rotate the sites because that prevents accumulation of the medication in one area. The needles are usually 25 to 27 gauge, 3/8 to 5/8 inches long. The angle is usually given at a 45-degree insertion, and always bunch up the tissue. So pinch the fat to give the sub-Q injection in. So intravenous medications and administration. So intravenous is injection of medication directly into the vein. This is to treat illness, prevent illness, assist with diagnostic procedures, and to provide nutrition and hydration. This is the quickest method of administration in an emergency situation. Always check your state regulations for the scope of practice allowed. Some states do not allow LPNs, or they don't allow them to start IVs or give IV medication. So make sure that you know what your scope of practice is for that state. The advantages of IV medication is rapid absorption, quick relief of symptoms. It provides options for medication and fluid delivery. It allows the avoidance of multiple injections. And the indwelling catheter can be used for more comfort. And of course, it's the fastest method in an emergency. Complications are infiltration, embolus, and infection. Disadvantages are incompatible medications can actually kill someone. So if you have two medications going at the same time that are not compatible with each other, it can cause severe complications. There's always going to be a higher risk of complications because you're going through the skin, so you're going to be more at risk of infection. There's usually a higher cost involved with IV medications, and of course, clots can form, which is never a good thing. So there's many different IV fluids. If it has a D in it, that means that there is sugar in it. So like D5 half normal saline, D5 normal saline. There's all kinds of different ways that dextrose can get into IV fluids. Saline. Saline is a sodium chloride solution. You will hear people say normal saline, half normal saline, 2% normal saline. Like there's different kinds. Lactated ringers is a mixture of dextrose, which is sugar, potassium, sodium lactate, and calcium. Total parenteral nutrition. This is used when the patient's digestive system needs recovery time. It's placed directly into a large vein via a special long-term IV catheter. It provides well-rounded supply of fluid, electrolytes, calories from fats, proteins, and vitamins. Other IV fluids, you can give lipids. These are fats containing soybean or safflower oil added to water, glycerin, and egg yolks. This is to give extra calories to patients, especially if they have some sort of a wasting disease. Also, you can give blood and blood products IV. This usually will correct blood loss in situations such as hemorrhage. It also provides missing clotting factors for patients with hemophilia. The patient will have to be typed and cross-matched to prevent transfusion reactions, which can happen often. But 100%, I don't care if you hear anything else I say in this entire lecture, always infuse with normal saline. That's all you can infuse blood with, or blood products, is 0.9% normal saline. So an infusion is a slower IV administration of a large volume of fluid. So it might be going at 60 milliliters per hour, 50 milliliters per hour, 30 milliliters per hour, 200 milliliters per hour. So that's an infusion. A piggyback is a separate IV bag that is attached to the primary IV tubing, and this is basically to administer medication over a short period of time. So these are the little bags that you see, such as antibiotics or potassium, different types of antibiotics especially. An IV push is basically when you need to have a quick delivery of a small amount of medication in a syringe. So an example of an IV push medication would be morphine. And also safety protocols have to be followed to avoid patient injury. And of course, you have to make sure that you are within your scope of practice. Now, these are different supplies related to injectable medications. Ampules, that's what you'll see right there on the left. If you notice, these are glass. It's a small glass container, and it holds only one dose of medication in the solution. You have to break the ampule carefully by using a piece of gauze. If the drug is in an ampule, you have to insert the needle into the ampule and draw up the fluid into the syringe. Make sure to use a filtered needle and change the needle after drawing up the medication. The reason that you use a filter needle is to make sure that you don't have any glass inside of the syringe. Vials are glass or plastic containers sealed on top with a rubber stopper. You'll see these more often. They may be single or multi-dose vials. They may also contain liquid or powder requiring reconstitution. Needles are chosen based on the length and the gauge. The length of the needle, 3/8 to 2 inches. And as you can see, 3/8 is a lot shorter than a full inch. Shorter needles are used for intradermal injections and longer for intramuscular injections. Needle gauges. This means that the inside of the needle is fat. So the gauge is chosen based on the site of injection and the viscosity of the fluid being given. So you see the 27 gauge, it actually goes backwards. So 14 is the largest gauge, so that's the fattest gauge, and 27 is the smallest gauge. Safety devices are required to prevent accidental needle sticks. There is a wide variety available. You'll get to see these in lab. Syringes hold the fluid to be administered. As you see, there's the barrel, there's the plunger, there's the tip, the hub of the needle, and of course the needle. A 5 milliliter syringe is calibrated in 0.2 milliliter increments, and a 3 milliliter syringe is calibrated into 0.1 milliliter increments. A tuberculin syringe is used for tuberculin testing, intradermal injections, or with small amounts of medication. Insulin syringes are used for insulin alone, nothing else, insulin alone. And a standard or hypodermic syringe, these can hold 3 to 60 milliliters of fluid. This is for intramuscular injections, flu, vaccinations, things like that. So why is it dangerous to recap a needle with so many safety devices available? And why may there continue to be problems with needle sticks? Well, we get busy, we don't think about it, and we walk away, or we think, oh, I'm just going to put this needle on here and walk down the hall, blah, blah, blah. Just, you can't do that. IV administration supplies. So there's the fluid bag or bottle. There's a pole. There is your IV tubing can be 6 to 120 inches. There's usually always a filter to make sure that nothing solid goes into the patient's vein. And all supplies must be sterile. Intravenous needles, this is a picture of butterfly needles. You'll hear people all the time say butterfly. This is a winged infusion set, and it's a smaller gauge. This is pretty much used for short term, easy to insert, and it's more likely to lead to infiltration, and it's very uncomfortable because the needle is still in the arm, in the vein. So then an angiocath needle is a straight needle, has a larger gauge, and usually if you're going to have IV fluids or medications for a longer term, you need to use a 20 gauge needle. The angiocath is used to introduce the catheter and then removed, leaving plastic catheter inside the vein, so it's much more comfortable. It's used for long term. It's more difficult to insert, and Inadvertent vein puncture is less likely and it is more comfortable. So before you start an IV, you're going to place the tourniquet 6 to 8 inches proximal to the site to be used. You're going to stretch the skin 1 inch from the insertion site, and you are going to secure the site with an occlusive, waterproof dressing and tape. Complications, infiltration. This occurs when the IV catheter becomes displaced and allows IV fluids and medications to leak into the tissue surrounding the vein. In this scenario, make sure you remove the IV. A thrombus is a blood clot, or phlebitis, which means vein inflammation. This can result from extremes in solution pH, needle or catheter trauma, particulate material, irritating drugs, or selection of a vein too small for the volume of solution infused. A clot can actually occlude the catheter, causing it to be difficult to flush. Air emboli, this is bubbles released into the bloodstream. Be careful to purge all the air from the IV tubing before securing the line in the patient. Always, before you do anything, you're going to fill all the ports and tubing by priming the fluids first. And particulate material, this is small particles that can cause vein irritation. Small pieces of glass can chip away from the vial or bottle. For this reason, many pieces of IV tubing contain a final filter in the line, so you'll see that occasionally. So all allied health professionals may initiate IV therapy and administer IV medications. That is false. Again, states differ in allowing scopes of practice for allied health professionals. An example of a solid topical preparation. The answer is A, a transdermal patch. Also, powders, remember, are types of solid topical preparations. Medications are given to treat allergies via all of these routes except the answer is C, vaginal. Inhalation medications that are easily carried in patient's pocket or purse are. The answer is D, the metered dose inhalers, the little small things. The proper angle to insert the needle in an IM injection is, remember, in an intramuscular, it's 90 degrees. That is all I have for you guys. If you have any questions, feel free to let me know.